Hi, everyone. I'm Julianne. I'm a program manager with the North Carolina Medicaid Ombudsman. Thank you all so much for joining us today. This is our introduction to the North Carolina Medicaid Ombudsman. We are very excited. We're excited to begin offering our initial services to North Carolina Medicaid and NC Health Choice beneficiaries tomorrow. During the early stages of Medicaid transformation, the North Carolina Medicaid Ombudsman will provide education, information, and referral services. As the need for additional services develops over time, our services will expand to include issue resolution, intensive problem-solving support for Medicaid Managed Care members. And now I will turn it over to my colleague, Natalie Marles.
Hi everyone, I'm Natalie Marles. I'm the outreach specialist for the North Carolina Medicaid Ombudsman, and we are just so happy to be launching this program. The state awarded the North Carolina Ombudsman in January of this year. Since that time, we have been working around the clock to establish this program, and we look forward to serve the North Carolina families and being a helpful resource. So as many of you know, North Carolina Medicaid is changing, and so it will be a managed care. And North Carolina Department of Health and Human Services is moving to North Carolina Managed Care. The North Carolina Medicaid Managed Care is intended to focus on health and care management, moving to an integrated care to address both medical and non-medical drivers of health. This means that the Medicaid services will be delivered through health plans that provide healthcare services for their members, and each health plan will have a network of providers. The North Carolina Medicaid Ombudsman will advocate for people with Medicaid to get the care that they need and help them navigate the new environment by providing free, confidential services. So our main responsibilities will be to educate, teach, and inform people about Medicaid rights and responsibilities under the North Carolina Medicaid Managed Care and what the change means for them. We will also conduct outreach to community-based organizations, providers, stakeholders, and beneficiaries to educate key players about these changes to managed care and about all the services. We also will advocate. We resolve problems so individuals with Medicaid can get the care that they need. We will refer and connect. We will connect people with Medicaid to community service to support health-related needs, including legal aid, social services, and other support for a wide variety of issues. We will provide a warm handoff to other organizations and follow up with referrals. We will help with dispute issues resolutions. We will help resolve problems such as enrollment issues, access to care, transportation, discrimination, language access, and more. We will be tracking issues and creating trends reports. We will communicate issues we learn from beneficiaries' experience to the North Carolina DHHS to track problems and work toward solutions. We will make sure the voices of the families covered by Medicaid are heard and that they can access high quality healthcare. There will be 4 ways to connecting with the North Carolina Medicaid Ombudsman. As right now, by phone, you can call the number that you are seeing on the screen. The email will come in soon, and now we are having an online access through our webpage, which is also on the screen. And coming soon, due to this pandemic, we are not seeing anyone in person, but we will look forward to see beneficiaries and help families in North Carolina in person. The services that will be provided by the North Carolina Medicaid Ombudsman, as I mentioned it before, will provide information to Medicaid beneficiaries about their rights under managed care and North Carolina Medicaid Direct. We will offer members guidance by filing appeals or grievances with their health plans. We will help investigate issues reported by members and help them try to resolve those issues. We will continue monitoring the issues member experience with their health plans and communicated this to the state. And we will making referrals to community service to help support health-related needs. While the North Carolina Medicaid Ombudsman is a partnership between Legal Aid of North Carolina, Charlotte Center for Legal Advocacy, and Pisgah Legal Services, the Ombudsman do not provide legal service. The North Carolina Medicaid Ombudsman will refer clients in need of legal services to an appropriate organizations, and there will be a clear line between the Ombudsman work and the legal services provided by each of these organizations. Just to give you a little background about the existing North Carolina Medicaid program, the Medicaid in North Carolina is currently a government-financed health insurance program that covers some low and moderate income families, individuals. And in North Carolina, there are over 2 million people that are covered by Medicaid. In addition, there is more than 100,000 children covered by the North Carolina Health Choice. With a few exceptions, Medicaid currently operates through a free fee-for-service system in which the state pays the providers directly. The North Carolina Health Choice is a federal child health insurance program which provides coverage to some low and moderate income children with families' incomes higher than the Medicaid eligibility limit, but below the state specific limit. Current Medicaid Managed Care in North Carolina, while most of the Medicaid current operates under a fee-for-service system, service for individuals with significant behavioral health needs or intellectual or development disabilities are provided through a managed care organizations, which are called the MCO. And there are local management entities, which are the LMEs, which contract with the North Carolina Department of Health and Human Services to manage these services. And here I'm going to show you the regional LME and MCOs map in North Carolina so you can have a little bit of understanding what that means. So as many of you know, North Carolina is transitioned to managed care. What are those changes means? So that means that the health plans will have a network of providers and services that generally must obtain from providers in a person's health plan network. There's also that most people with Medicaid will enroll in standard plans and coverage will begin starting in July 1st of this year. Individuals with significant behavioral health needs or intellectual or development disabilities will have a choice whether to enroll on a health plan until July of next year of 2022. North Carolina Managed Care is intended to focus on health and care management, moving to an integrated care to address both medical and non-medical drivers of health. North Carolina, so what is not changing on this transition? So most Medicaid beneficiaries must choose a health plan in North Carolina Medicaid Managed Care program. Some people will stay in now what we will call the Medicaid Direct and will not need to choose a health plan and they cannot enroll. Other programs will have the options to enroll in a health plan, and health plans are responsible for reviewing and evaluating requests for services. There's also not changing the eligibility rules, and the application process for North Carolina Medicaid and North Carolina Health Choice will be remaining the same. Covered services, health plans may also offer other services, and it will not change the way that services are authorized and or delivery from those that choose not to enroll on a health plan. The waiver waitlist will not change, and neither the clinical coverage policies. North Carolina Medicaid transformation timeline. So as many of you know, the open enrollment begins March 15 of this year. That's when the Medicaid start having the enrollment period. So beneficiaries can start enrolling on either of the plans offered by the state. There's also the auto enrollment. So beneficiaries that do not choose a Medicaid a plan by May 14, the state will choose a plan for them. And the tribal options for managed care will be launched on July 1st of this year. And the end of choice period will be on September 30th of this year. There is also some engagement milestones timeline that we will have. So in November, the North Carolina Managed Care website went live last year. Then the North Carolina Medicaid Beneficiary Portal was on November 23rd of last year. And then we have the North Carolina Provider Health Plan lookup go live on January of this year. And everyone that was enrolled in Medicaid start receiving letters on their home addresses or mailing addresses by March 1st. And then the open enrollment begins on March 15. As I mentioned it before, the beneficiaries outreach events starting on March 16. The auto enrollment will start on May 15 if you didn't choose a plan. And the mail members welcome packets and ID cards will start on May 16, and the tribal options will start on July 1st, and ongoing health plans and member support and member advisory committee will also start on July 1st. So Medicaid Managed Care enrollment groups. So who must choose a health plan? So most of Medicaid and North Carolina Health Choice beneficiaries needs to choose a plan. The federal recognized tribal members and other eligibility for services through the Indian Health Services. Beneficiaries who needs extra services for development disability, behavioral health, traumatic brain injury, and substance use disorder, they will have the options to choose a plan. And who does not need to enroll in a health plan is some people with they can stay on Medicaid Direct. For example, individuals who receive innovation waiver services, traumatic brain injury, community alternative programs, and children's or disabled adults. There will be some health providers. Right now in North Carolina, there is a MediHealth Caritas, Healthy Blue, United Healthcare, WellCare, Carolina Complete Health, and those are the regions that they will be serving. There is also the Eastern Band of Cherokee Indians tribal options that are available for federally recognized tribal members and other eligible for service through Indian Health Services. And I'm going to show you the map for these regions so you will be more familiar which provider will serve the county that you are living on. So here is the map of the Medicaid Managed Care regions. And as you see, there will be 6 regions in North Carolina. And here is the map with the list of each county that each region belongs to. And as Devin mentioned at the beginning of this presentation, you can just send us any questions that you have. Now I will pass the presentation to my colleague, Jules.
Thanks, Natalie. You did a great job. Thank you for that helpful information. All right, next slide. All right, so a question that many people are asking is what is happening to LME MCOs? So now until July 2022, LMEs will continue to manage care only for those with significant behavioral health needs or intellectual and developmental disabilities. We'll talk a little bit more about that coming up. And then individuals with physical health care for this population will continue to be in North Carolina Medicaid Direct, which is what they're referring to for the fee-for-service program. So after July 2022, that's when we'll have the tailored plans. So the LME and MCOs are the only entities which can apply through DHHS and lead a request for application process. And then DHHS will make a decision which LME and MCOs have been selected as the tailored plans. And we will find out about that in 2022. So that then at that point, the tailored plans will manage both services and physical health care only for those with significant behavioral health needs or intellectual developmental disabilities. And there will be one tailored plan per region. Next slide, please. So individuals that are interested in staying in Medicaid Direct, also known as their fee-for-service, or individuals who end up enrolling in a PHP and then maybe need to move back to the Medicaid Direct, there are 2 different bases for that. So diagnosis or use of services, also known as need. So if someone has a specific diagnosis, then they can elect to stay in Medicaid Direct. And also if an individual is utilizing services to a certain level, then they can also opt to stay in Medicaid Direct. This is also the case for individuals whose situation may change. So right now they may not have a certain diagnosis or a certain need, and they may, have to go ahead and enroll in a PHP. But then at some point that may change, people's circumstances change. And if they do receive a certain diagnosis that meets this criteria or use of service or need, they will be able to elect to change and get out of their PHP and go to Medicaid Direct. Next slide, please. So plan selection. So during open enrollment, which is March 15th through May 14th, as Natalie mentioned, members have 60 days to select a health plan and a primary care provider, as well as an advanced medical home. Those who do not select a plan will be automatically enrolled based on data and information that the enrollment broker has. So members have 90 days after health plan coverage begins to change their health plan for any reason. So individuals that are enrolling with an effective date of July 1st, they will have until September 30th to change plans for any reason. So if someone is auto-enrolled and then they end up realizing that their PCP is not in network with the PHP that they enrolled in, that sounds like alphabet soup. Then they have the option to change PHPs in that 90-day window, and they don't have to have a reason for that. After that 90-day window, they will have to have good cause. Exempt beneficiaries can disenroll at any time after 90 days. We already went over that. They cannot change their health plan until their Medicaid recertification date. But again, if they have good cause, they can do that. And they have appeal rights if they are denied. Members who do not select a PCP will also be assigned one by their health plan, and members can change PCPs up to twice a year for no particular reason. Next slide, please. So when individuals are changing health plans, it's important that they know that they have until September 30th to do that. After September 30th, unless they have a special reason, they will not be able to change those health plans until their Medicaid recertification date. And if they are interested in requesting a change to their health plan, they can contact the North Carolina Medicaid Managed Care call center. This is the phone number to be able to do that. Next slide, please. So when individuals are interested in enrolling, they likely have gotten a notice in the mail with this information, but it's important that they know. So they can contact the Medicaid Managed Care Enrollment Center at this phone number. There's also an app for iOS and for Android. They can also contact them by mail, online at ncmedicaidplans.gov, or they can contact them by fax. Next slide, please. So individuals that are interested in staying in Medicaid Direct can do so by completing a form that is online, or they can submit the form online, or they can mail it in. So individuals that would want to do this are most people who have behavioral health, substance abuse, intellectual and developmental disability, or traumatic brain injury, that they continue to receive Medicaid services through NC Medicaid Direct. They will receive their health and pharmacy services from the state and behavioral health services from the state or an LME MCO. And most people who receive services from an LME MCO will stay enrolled in Medicaid Direct. However, we have heard, especially with the rollout the first time in 2019, that some individuals who really should be staying in Medicaid Direct may still get notices that they need to enroll in a PHP. And so in that situation, that may be a situation where they need to complete or request to stay in the Medicaid Direct program. If an individual is receiving care or care for serious behavioral health or intellectual disabilities, they may be able to stay in Medicaid Direct for now and to request not to enroll in a plan. And this is where they can complete the form. They can do it, or there is a provider form where the provider can also assist with that. Care managers can help with that process as well. And the form can be found online at ncmedicaidplans.gov. If the request is denied, it's important for beneficiaries to know that they do have a right to appeal. That information will be in writing, and those appeal rights should be on that notice. That's a requirement of the state. Next slide, please. So non-emergency medical transportation, also referred to as NEMT. This was something previously that our Medicaid program was in charge of, and now that's being transitioned over to the PHPs, the prepaid health plans. And so they are required to provide this service for enrolled individuals. And DSS, though, will continue to cover the NEMT services for the EBCI tribal option members and Medicaid Direct beneficiaries. So it's just for individuals that enroll in a PHP. Those individuals now will have their NEMT services serviced by the PHP. Individuals receive the same service from the health plans as they received under NC Medicaid Direct. That is incredibly important for these individuals. And there's no change to the amount, duration, and scope of NEMT. Individuals can contact their health plans as early as June 1st for appointments scheduled after July 1st to go ahead and start scheduling their transportation to any doctor's appointments they have scheduled after July 1st. So it's important that beneficiaries know that. Next slide, please. So a little bit more on NEMT. Plans must provide NEMT appropriate for the member to the nearest enrolled medical provider. They must provide it to a Medicaid covered service provider, including services not covered through Medicaid Managed Care provided by a qualified Medicaid provider, and provide travel related expenses, including lodging, food, parking fees, tolls, and transportation vouchers. They also must develop a network of NEMT providers. We know that the PHPs, I think for the most part, almost all of them have contracted with the same contractor. So that's good. We know that there'll be at least one entity providing that service. And beneficiaries can contact their health plan, or sorry, the members can contact their health plan starting again on June 1st to schedule trips taking place on or after July 1st. Next slide, please. So this is also an important part of this transition to managed care. So there are protections in place for beneficiaries. And it's important that we get this information out. Individuals need to know, what their rights are and what their protections are while they transition, especially, when it comes to their care and the continuity of care. Oh, can we go back? Yeah, thank you. So the department approves all of the marketing materials, and plans cannot engage in direct solicitations. And that, as far as the department approving marketing materials, that's the same for the enrollment broker as well as the ombudsman. Health plans must provide language assistance services, including interpretation and translation. Written and oral member materials must include taglines in the top 15 most common non-English languages in North Carolina. Grievance appeal and state fair hearing procedures, including timeliness standards. And then appeals are for denials of benefit determinations or denials of payment or of disenrollment. So individuals need to know that when they receive these denials, it is not the end of the road, that there is an appeal process in place. And there are lots of resources out there for individuals to get assistance with this. And while the ombudsman cannot assist in completing those documents, they can assist with the process, how to access those forms, what information needs to be collected, and help them through that process. Grievances include all other complaints against the health plan or providers. Health plans must have member advisory committees, including the long-term services and supports, and must facilitate transfers to different health plans or different providers when appropriate. Health plans must operate member services line, behavioral health crisis line, and a nurse line. So all of those are required as part of their contracts with the state. Next slide, please. So the key takeaways today, we've gone over a lot of information. Some of this may be duplicative based on, how many Medicaid transformation presentations you may have been attending over the last couple of months. But we did want to put together the key takeaways that we think are most important. So we really think that it's important for all of the community-based organizations, providers, anyone dealing with individuals in the Medicaid population, and the beneficiaries to know who is mandatory, who is exempt, and who is excluded. So that's really important. It's really important to choose a health plan and PCP unless exempt or excluded. And then because then members are automatically enrolled in a PHP and then assigned a PCP that may not be the PCP that they have been going to for years or they're not familiar with. Health plan changes for any reason are available for 90 days after July 1st. I think that's really important. Individuals see the enrollment period and then they may miss that, and then their plan starts on July 1st and they're not really sure what to do because it's, the plan doesn't include their PCP and they want to change plans. I think it's really important that they know that, there are not barriers for them to do that. Within that 90-day period, they do have the flexibility to change plans if the plan is not meeting their needs or, their providers with a different PHP. Eligibility for Medicaid is not changing. So I think that's incredibly important. Individuals that are eligible for will be eligible now as long as the eligibility criteria for that individual has remained the same. I think that that's really important. Medicaid continues to cover the same services. Services should not be any different. They should be able to access those as they have before. The health plan decides whether to approve services that the doctor requests. So that's incredibly important too. If they receive a denial for that, it's important that they pursue the avenues through the health plan to go through that process, to get that appealed and requested. Generally, members must see providers in their health plan's network. So that's something that I think is changing for a lot of individuals, is that, the PHP is now managing their care. So they need to make sure that the providers that they're going to are in network with that PHP, because not all providers have contracted with all of the PHPs. And there are no enhanced behavioral health, intellectual developmental disabilities, or substance abuse services in a standard plan. And so it's important, if somebody has those needs, that they either, elect to stay in Medicaid Direct, or if they, inadvertently enroll in a PHP and realize that their service, needs are not met, that they're able to disenroll from the PHP and enroll in Medicaid Direct to meet those needs. Next slide, please. So again, contacting the Medicaid Ombudsman, here is the phone number, 877-201-3750. Our hours of operation effective tomorrow are Monday through Friday, 8 to 5. And we have a lot of staff ready to go for you all tomorrow. So we look forward to answering questions, providing information, education, and making those referrals. And as we said at the beginning, as the need arises, we will definitely address those needs and make sure that we're providing adequate service to all of our callers and all members and beneficiaries in North Carolina. Next slide, please. So, we've talked a lot about providing information and education, and briefly, what does that mean? So one of our primary responsibilities is to educate, inform, and assist Medicaid beneficiaries with questions about the transformation to managed care, how to navigate the managed care system, and their rights and responsibilities under managed care. So I think it's really important, right now, not only do all of us that are assisting beneficiaries and members have questions, and we're all trying to catch up and figure out what's going on and how we can get through this process, but also I think it's really important for all of us to know, because beneficiaries surely have questions right now. As I said before, this is something that individuals may have been receiving Medicaid for years and it's been the same. And the fact that it's changing all of a sudden, I think is hard sometimes for people to understand, and they're not sure why, and they may be ignoring the notice because it's just one more thing they're having to deal with right now, especially with everything going on with the pandemic. And so I think that it's just really important for us as advocates for individuals, to just know that, know this information and be able to answer their questions to the best of our ability. And if we don't know the answer, to find out the answer, but also to report, issues or things that we're seeing to the state, so that adjustments can be made, and we can make sure that this entire process for individuals is relatively easy. Making sure that the PHPs are meeting their responsibilities, that the Enrollment call center is meeting theirs, that the ombudsman is meeting theirs, and that the state is doing their role as well, as the providers that are providing the services to these individuals. But our role does not end there. Next slide, please. So I think something that's really important about the Ombudsman program is that we are taking this no wrong door approach. So individuals that are contacting us, if we're not able to directly answer their questions or assist them, we want to know, what is your issue that you're having? How can we connect you with the services that you need? So we want to be able to, we have our staff ready and trained to provide general information and referrals for many other issues outside of just the PHPs and the managed care and the, their providers and things of that nature. So our staff is trained on Medicaid and NC health choice eligibility, private health insurance, including ACA health coverage, and referrals for food stamps, Social Security, disability, supplemental security income, and veterans benefits. And if there's something that, our staff can't answer, like I said, it will be referred out to an entity that can answer that. And so we do want individuals to feel that they can contact the ombudsman and we can connect them with where they need to be. We do hope that with issues with the PHP or the enrollment broker, that they are exhausting those avenues with those entities. And then if they are, unsuccessful in that they feel that they can call the ombudsman for assistance, because that's why we're here. We want to be able to assist individuals and get the answers to their questions and access to the care that they need. Next slide, please. So the referrals that we'll be making, we plan on referring the beneficiaries to agencies and providers who assist with issues that the ombudsman is unable to address. For example, food insecurity, things like that. And then staff will have access to resources that help identify the referrals to government agencies, healthcare entities, and other nonprofit organizations and others. Next slide, please. So the North Carolina Medicaid Ombudsman staff has a statewide, have statewide partner agencies that will accept referrals from the ombudsman for members who need or request legal advice or representation to assist with appeals and other issues. So there are, formal agreements in place in order to do this. So if a caller has an issue that needs to be, elevated to an attorney for whatever reason, we have those partnerships in place to be able to do that work and provide, that assistance as well, that referral to that entity. Next slide, please. And also we want people to know that we don't plan on just giving some information and then calling it a day. We really want to know that there is that referral was successful for that individual, and that individual got the answers to the questions that they had. But also, whenever someone is contacting the ombudsman, our staff is ready and we are ready to go to investigate their concerns or their issues that they're having. And also provide the appropriate follow-up, whether it's to the referral agency or to the individual, and then also get to a resolution. So we will advocate for beneficiaries seeking the best and most efficient outcome for them, and ombudsman staff will regularly communicate with beneficiaries concerning these efforts. So we don't want people to just feel like, that we're a place that you call and you can't get, access to things and answers to your questions. We really, like I said, want to be that no wrong door approach. When in doubt, contact the ombudsman and they'll connect you where you need to be, or they will try to resolve your issue, or they will assist you with getting the forms that you need or answer your questions. and get that information and education for them and refer them to the agency if it's something that we and as I said, as Medicaid transformation sort of proceeds and as it goes forward and we realize what services need to be added or how we can enhance our services, we plan on doing that and adjusting as the need becomes apparent. Next slide, please. So again, just because we're obviously trying to plug how to contact the Ombudsman, you can contact us by phone, online, and obviously when it's safer, we'll have it in person, and then our email contact is coming soon as well. Next slide, please. So for any questions that individuals have, you can always reach us at our website, ncmedicaidombudsman.org. You can also request a presentation there. And our website right now is up and running. Like we said, tomorrow is the launch date. And we will have more accessibility to requesting a presentation and direct email and things of that nature in the coming weeks. So we really look forward to partnering with other community-based organizations and our partners across the state. And we look forward to serving Medicaid families in North Carolina and really being a resource for not only these beneficiaries and members, but also for our community partners and providers to the extent that we can be. So thank you all so much for your time today and joining us for this presentation on the North Carolina Medicaid Ombudsman. We will, I guess, start to answer the questions that are in the chat. But thank you all so much for your time